Hi, welcome back. I'm Alga Ramos, and today we're going to talk about helpful apps for a short-term medical mission trip. The main applications that I want to discuss are these four here. I wanted to note that Lexicomp and UpToDate do require a subscription. This is something that you could potentially already have through an organization. For example, if you work for a hospital or any other healthcare setting where they do provide you access to certain drug information resources. A substitution could be Micromedex, and then we're going to talk about two free resources, Medscape as well as AboutHerbs. Lexicomp, I really love. It's actually one of the main apps that I like to use, but something you need to keep in mind is that it has multiple libraries. What this means is that if for whichever reason you need to be offline, which tends to happen if you're in a remote clinic, you may need to download these libraries ahead of time. You see here that they all mention the weight in terms of the memory your phone will need to use or iPad. I am downloading one here as an example just to show you that it can take a little bit of time, so make sure that you download these before you go on your trip, and make sure that you also have like a strong internet connection before doing so. The libraries that I really like from Lexicomp, they have drug information, they have Trizzle's IV compatibility, but for a medical mission trip, it's really Lexi Drugs. If we go into it, we'll see that there's a lot of different drug information. For example, here we're going to search for any drug, right? It could be an over-the-counter drug, it could be a prescription drug, for example, ivermectin. You have dosing based on the indication, given that we might do a different dose depending on what we are treating and for how long we're treating. You have any dose adjustments available, which are very helpful. We also have a section for off-label uses as well as how to administer the agent. You may need to get creative in terms of administration, like for example, intravenous solution dexamethasone, you may need to administer it orally. I also like that for these drugs, in the example of ivermectin, I can see here contraindications. I can also go down to adverse effects, and they do highlight notable ones. Like for example, we see Masodi reaction here. We actually had a patient that had this reaction happen to them. So it was very useful to be able to go through Lexicomp and read up a little bit on the expected onset for the reaction, what to do to mitigate it, etc. The next library that I like that they have available is actually Lab and Tests. When you go into that one, you'll see a multitude of different labs, and this may be useful if you have a patient that brings external labs, or maybe you're doing a lab within your clinic, and just as a quick review of how the collection process is done once it's processed, what the interpretation would refer to depending on the different agents assessed. So for example, you saw their IgM, IgG. They also have good functions for patient education, and I really like that they have a natural products database. For example, I'm searching here moringa, which is something that you might see traditionally in Latin America, and it gives you an overview of the uses, dosing, and most importantly, adverse drug reactions. They even have a section on drug-drug interactions, which I feel that it can be very helpful. Sometimes you'll have a patient that comes in through the clinic, they have a chief complaint, and lo and behold, it may be their natural supplement that's interacting with something else that they are currently taking at home. The next application is UpToDate. This is actually from Wolters Kluwer, so the same company that does Lexicomp. They also have a drug database, but it's really Lexicomp. The reason that I use this application is more so for disease state review. For example, I'm looking up here rabies post-exposure prophylaxis. They have a lot of really great algorithms and review tables in terms of treatment modalities. So for example, you see here, was it a dog or a cat? How was the patient potentially exposed to rabies? And in the next setting, you can even see the World Health Organization recommendations in terms of prophylaxis, post-exposure prophylaxis, or treatment. And you have all of that very handy. The only main caveat is that you would need an internet connection in order to access this information. And you can even get CME out of it. This next application I love, and I've been using it for I feel like decades now. It's free. Medscape, I love it because it has a lot of core information embedded. Like you have an interaction checker. For example, a patient comes in, they have multiple drugs, or you're considering adding maybe hydroxychloroquine for malaria. You can quickly look to see if there's any interaction present, and they do give you like a very quick briefing on what to do. They have other features such as calculators as well as drug ID. For the calculators, it does get a little bit tricky. I had good internet connection, and even still you see that some of these were loading, but once you have some of these available, they can be helpful in the clinic setting. For example, I'm doing here ideal body weight. They're very straightforward. Drug ID, I have needed to use. The only caveat is you would need an internet connection for this. In Lexi, you could download their drug ID library. It just will take up a lot of space on your phone or iPad. And we see there, for example, we looked up H01, which turns out to be fluconazole 50 milligrams, so that's great. And the last thing that I find very helpful is going through disease state reviews. So for example, if we search here for actually medications, we can get a very quick snapshot of dosing for adults versus pediatrics. It's very straightforward. You also have a section for pharmacology if you're interested in reviewing mechanism of action. There's another section where you can quickly assess toxicities that could be provoked by the drug. So you see over there down in adverse effects. So it's a very quick glimpse. If you need something that's going to be a little bit more reliable, this section you are able to access once it's offline. So it's been very, very useful to me when we're in remote clinics. And lastly, we can see that there's even a section for disease state management. So if I look up dengue, you see that there's an overview. They tell you the clinical presentation, so you can read up on the history, epidemiology, what are the common signs and symptoms. You even see treatment and management, where they'll tell you a little bit more about the framework. But if you want to just skip over to what drugs you use, you would just go to the medication summary and see what drugs are available, if any at all, which we know dengue is more so symptom management. Next, we have AboutHerbs. This one is another free app. I love it because, again, you go to a different country and there may be a lot of natural herbs and supplements that are being leveraged for a multitude of reasons. So here you actually have professional view as well as a consumer view. I like to keep it in the professional view to get a little bit more in-depth information in terms of the uses, what data is out there for each of the drugs. But you see here that it goes through contraindications. You even have ADRs, and they go into a lot of detail whether there's been case reports or where the data is coming from. There's herb-drug interactions, which, for example, here we had turmeric, and you see there's interactions with anticoagulants, or there may be interactions with some antifungal drugs. And if you continue scrolling all the way to the end, you even see herb-lab interactions, which is something that we don't often think about, but we do need to be mindful of. I wanted to add in a fifth application, which is very helpful. The only thing is that it is expensive and you even need to buy the equipment, but it's called Butterfly IQ. This is an application and product that allow you to do ultrasounds on the go. And you can see here in the images, this is from actually my last medical mission trip. We had a phenomenal emergency medicine doctor that she was doing pregnancy ultrasounds. She was looking at a patient's gallbladder. In other trips, we've had other emergency medicine doctors look at patients' thyroids or anything else that may require an ultrasound to better assess how we're going to manage the patient. So I think that this was great. She was able to connect it to her iPad. You can also do it to an iPhone. It's very portable, but you do need to remember to bring in the ultrasound jelly. Last but not least, we have some bonus apps. WhatsApp is very useful for communicating if you want to kind of decrease those service fees. And I also like to have iTranslate. I'm showing you here how it functions. I do want to bring the caveat that it is not a perfect app. For example, here I'm trying to translate Swish and Spit for a magic mouthwash over to Spanish, and it only did half. Half is helpful, but not exactly what we were looking for. And this is a common limitation that you may see with a lot of these translation apps, but it can come in handy. You see here that I was trying to do gargaras, which would be like to gargle in English. So you might want to write, my patient, please gargle, and then spit the magic mouthwash. But it can be helpful if you're trying to translate something simple that you want to write down for a patient. Like here I'm doing it reverse, right? Spanish first over to English. But if I wanted to tell my patient to take 1 tablet daily, I can quickly and easily do that, so I can write something down for my patients in a remote clinic. And that is it. Those are some of the core medical apps that I like to have handy when I go on a medical mission trip. So I hope that this has been helpful. Please don't forget to like, subscribe, and share. Thank you. Have a great day.